Good afternoon and welcome to Mercy Health Muskegon's Healthcare Spotlight, where each week Mercy Health will bring you important and helpful information that helps you be more informed and involved in your healthcare decisions. We believe that carefully listening to you and encouraging you to take an active role in your healthcare is just as important as having access to our specialists who use the latest technology. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive, faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or. It's all of these and more. It's Mercy Health. Welcome. My name is Erin Patrick. I'm the Regional Manager of PR and Communications for Mercy Health, and today I have the privilege of talking with Tressa Crosby, who is the lead community health worker at our community benefit ministry, the Muskegon Community Health Project. Thank you, Tressa, for joining us.
Thank you for having me.
Yes, I am just excited because community benefit ministry is extremely important to our organization, and I know you guys are doing so much to impact our community. I was on your website and I didn't even know where to start, so we're just going to try to cover as much as we can in the time frame that we have. And so I'd like you to first describe what your average day is in a nutshell as a lead community healthcare worker.
Well, an average day can be pretty chaotic sometimes, but some days, we have some that are pretty mild. But I've been with the Health Project for the last 6 years. Okay. And actually, this is my second go around. I was working with another employer, and someone called me with a job opportunity, and I was so grateful to come back. Mm-hmm. So I enjoy working for Mercy Health, and I serve as a lead community health worker. So we have a team of about 30 community health workers that are out in the community.
I didn't realize it was that many.
Oh, yes. There's more than that, actually. Mm-hmm. But so I have a team probably under me of about 10.
Okay.
And then there's another lead that works with a particular program called the Pathways to Better Health. So on a daily basis, we have huddles. We come in and we look at what our day is going to be. We also look at their caseloads and see what folks that they'll be serving out in the community. This is one of the programs that I help to oversee is a home-based program where folks, our community health workers go into the community and into the homes and meet people right where they are. So
okay.
A lot of what I do is kind of a peer supervisory role.
Mm-hmm. And so the Muskegon Community Health Project has been around for a while, but you've been with it for the last 6 years. If you could describe what the Community Health Project is as an asset to our community, how would you describe it?
Well, the Health Project has been around for over 20 years in this community, in Muskegon. And then as it has grown, it's expanded in its services. And so now we're able to offer services in Ottawa, Oceana, and parts of Newaygo County. So we cover a vast amount of territory. And then the asset that it is to the community, gosh, we have a passion for serving the poor and the underserved. Mm-hmm. Those folks who are having struggles getting access to health care. We provide a very welcoming access point for people to come in, ask questions, and get really more of what they even thought that they were going to be able to do.
Well, in the healthcare system, period, I think we've talked about it on this show before, is extremely hard to navigate between, insurance and Medicare, Medicaid, as well as, just having an advocate that you can lean on when you have questions. And when you had mentioned, that you serve the underprivileged, I mean, that is completely aligned with one of our core values at Mercy Health, which is commitment to the poor. And because we are a faith-based organization, we put the most vulnerable people in our community first. And I think just to have a group under Mercy Health dedicated to serving that population is so important. So if I don't thank you before the end of the show, thank you right now for the work that you do. Because I have heard some testimonials on things that you guys have done for patients in our community and things that you do on a daily basis that people don't know about. And that's what we're here today to kind of shed some light on what we're calling Muskegon's best kept secret.
There you go. That's awesome.
So tell me, why you love what you do. Okay, so you're working as a lead community healthcare worker. You're serving as a mentor for some other colleagues on your staff. Mm-hmm. How did you come about to this kind of work, and what do you love about it?
So initially I came kind of because I had a passion about an an issue in our community. And when I originally came and approached the health project, this is probably about 8 years old, I came with an idea, and they brought me on board.
What was your idea?
And my idea was we were looking at addressing childhood lead poisoning prevention.
Okay.
And we were able to help create a collaborative around that in Muskegon County to look at preventing children from becoming lead poisoned. And that was a very successful initiative. When I came back the second time, I came back to work with a program called Pathways to a Healthy Pregnancy.
Okay.
And so I came to, they had just received a grant, and I came to start a program to address high-risk pregnancies in Muskegon County. And that has been a phenomenal way to serve our community, to get to know people. So what makes me passionate about what we do as the Health Project is we listen to the voice of the community. So if an individual comes and has a concern and say, hey, I'm concerned about this in our community, and we would like something to be done, the health system listens. And one of the ways that we listen as being the community benefit ministry of Mercy Health is we do a community health needs assessment.
Okay.
That's a listening tool to see what's on the heart of the people in the community. And so they're able to bring up their issues. If they're concerned about, there's not enough access to transportation. Even if I wanted to get to the doctor, I can't get a ride. Maybe some of those who live in the rural communities say, hey, we need busing out this way so that we can get to where we need to go. These are concerns that people have on their hearts, and they're able to say, and we do different types of forums to bring that information out. It's brought in and they compile it as a community health needs assessment. And then the work that Mercy Health does is based on that needs assessment. So that's one part of community benefit that we do. So I'm passionate because I feel like they give people a voice, and they listen, and then they create a plan to address the needs of the people.
Well, and I think that's important to mention because a lot of times organizations just figure they know what people need or what people want. To know that you've done this needs assessment and you've surveyed the people that actually would be receiving these services, I think is just telling to how centered your organization is on those community members. What do you typically work in an office setting, or are you out and about in the community on a more regular basis?
So initially when I began, I was a health worker, a field-based health worker. And so I would go out into the community and do home visits. So I had the intense pleasure of meeting clients in their home, in their own space, which you become a guest in a person's home. Even though you're there to provide a service, you feel so privileged because they opened the door and let you in. When you go into someone's personal space, that's kind of sacred ground because you're going to look and you're going to observe lots of things. And it's a different type of maybe patient privilege or client privilege that they're giving you when they bring you in, and you get to discuss things and you go over your checklist. So a look. What a community health worker would do is once they go in the home, they'd complete a checklist, they'd have conversation and figure out what does this family need and what's on this family's heart, Again, it's listening to the community. And I would often ask my clients, I said, if you could have anything today, we're not talking about money or no issue, there's no barriers. What is it that you'd really like? And then they'd give an honest answer. And, if what's on their heart, if they would say, I really would like someone to help me with my light bill. Okay.
So it's really some of those basic immediate needs that will come up that maybe is creating a barrier for them.
And so then our job as community health worker would be to look in the community and see if there's resources to help that individual address their needs. So if it's the light bill, water, gas, we're out looking for resources for them.
Okay, so let me back up a little bit. How do you get in touch with these people before you're visiting their home? So let's say there's a struggling family out there. How would they, and hopefully they're listening today, but how otherwise would they know that they could have or benefit from some of your services? How do you get in touch with those people?
A lot of our clients come through referrals. So they could come through a provider's office, but they also come through community agencies, and individuals are able to refer themselves. So if they feel like, I need some help navigating the health system or community resources. They know that they need help. They don't know where to go. And so they're able to connect with our programs to get the assistance or to get help navigating this community resources. So most of our folks, there's different eligibility requirements. We have several programs, and we like to say that, we service people from womb to tomb. I mean, we just do the whole spectrum, okay?
Okay.
So from birth,
that is quite a tagline.
Well, from birth to all, we have to deal with some of end of life issues.
Sure.
But this is life. This is life in Muskegon County. For those of us who are born and raised here, we still claim, which hospital we were born at.
Yeah.
I'm a Hackley
Me
baby.
too. Hackley, all the way.
So, I think it's kind of cool that we have programs that help to serve that spectrum of life. And so most of our services cater toward folks who are Medicaid or Medicare eligible.
Okay.
If you are uninsured, there are also programs that we have to help you. So we can help to see if you're eligible for an insurance, how to apply for it.
So would this be like the ACA or whatever?
Yes.
Who knows what's coming next? But if they're wondering, okay, how do I obtain insurance for myself or my family? Then
sure. They can walk into the Health Project, and we have walk-in hours, we have appointments available, but there's folks there who can help you navigate and to see what's available through the Affordable Care Act. Or if you have Medicare, you don't know which plan to pick, we have Medicare counselors that can sit down with you and spend time and help you see what's available and maybe what plan would fit you best.
So if I were someone in Muskegon or the other counties that you serve and I wanted to come speak to someone face to face, where's your office located?
So we're located at 565 West Western.
Okay, so you're right downtown. I guess right across from the caboose, right?
We are right from the convention bureau.
Hey, so I got to pick land. I'm sometimes directionally challenged. You guys give me landmarks. I can get myself there. So if people know downtown Muskegon, they'll probably know what I'm talking about.
There you go.
And you face the lake.
We do.
So it's a welcoming office. I've been in there. And if somebody walks in and says, here's what I'm in need of, is this some type of service that can be provided right on the spot, or do you take their information, get them into your system? What's the turnaround like for somebody who needs help?
Depending on what you come in for, what your need is. So we also have a prescription assistance program when we help lots of folks that are in need of prescriptions and they can't afford it. They've got some copays that may be high. So they can come into our office. There are certain documents that we need. But our turnaround, we're doing the very best to get those medications turned around so that they could have access to those as soon as possible. Especially if you're an individual that has diabetes or there's a high blood pressure medication, things like that need some immediate attention. We're going to do our best to make sure that that's expedited for you.
Now, if I need help with insurance or Medicaid and picking my plans, is this something maybe I should call ahead for and just say, hey, my name's Erin, I need some assistance on this? Do you make an appointment for something like that maybe might be a little bit more, complicated?
Yeah. For those things that are more complicated, may take a little bit more time because there's some of them are lengthy applications. We like for you to call and set an appointment. That way we can let you know ahead of time what documents to bring, because sometimes it takes time to acquire all of your documents and get them prepared so that you can bring them into the office. And then we'll sit down. A lot of things are online. So we sit down with you right in front of a computer and we start to help get that application filled out. And we upload your documents. So it's a very friendly, low-key, down-to-earth office.
So I don't have to know anything, right? I mean, you'll tell me what documents I need, but I bring them in there, I hand them to you, and then you help me get the ball rolling on all these things. Because I would anticipate, especially for me, I wouldn't know where to start. I'd come in with my stack of papers and say, Tressa, here you go. Take care of me, right? Is that how it works?
That's how it works. What's great is when folks come in just like that, we sit down with them, we take them through the process. And if it's lengthy, sometimes it can take an hour, a couple hours to get through it. But after that, they leave with so much relief because 9 times out of 10, we're able to help them with more than they even thought that they'd be able to help with.
And probably the other 1 time out of 10, you're able to connect them with another agency that you collaborate with that probably serves that section of their need directly, maybe.
Yes. So we have lots of community partners. So if we can't do it, we're going to connect you with whoever we believe could best serve you.
Okay, great. Let me talk to you. We're in the season right now. And do you remember Summer Celebration? Mm-hmm. Right downtown by where your office is.
Definitely.
We're trying to celebrate really good success stories at Mercy Health. And the Health Project probably has more than what we have time to tell. But I'd like you to just share, if you can, just take a second to think about it, to just share a couple of your most favorite moments while helping, some of your clients at the Health Project.
So I'm going to share a story of one of my colleagues who helped in our pregnancy program, a high-risk mom who she's pregnant. She's had a 1-year-old at home. She was homeless.
Oh, my.
Lots of things just working against her. And sometimes when you're in that situation, you're dealing with some health issues, your own self. So your pregnancy is high risk. You can be dealing with some mental health issues, too. I mean, depression and anxiety can go along with that.
Yeah, especially with being pregnant just in general. You have your hormones and you're imbalanced all over the place.
Sure.
So, I can imagine that would be a struggle for sure.
Exactly. So this young mom was able to connect with a community health worker who helped to walk her through going from homelessness, connecting her with our local housing resource agency. And she was able to help her get housing. And then from there, once that mom got stable, that mom was able to give birth to a full-term, healthy weight baby.
That is so
There's
great.
income coming into the house. And the success about this is this mom went from just homeless and really down and out to she had a healthy baby. She got a job. She's working full-time and taking care of herself and her kids. We're just so happy that we could be part of that journey. So that's a story that I really love to share. And then there's other stories that folks who come in looking for, not thinking they could get help with medications, but they walk into the Health Project doors. They're able to find out, we screen folks to see if they are eligible for other services too.
Right.
So services that they may be eligible through the Department of Health and Human Services, whether it's help with food assistance or cash assistance or childcare or things like that. The Lions Club to help with vision. We screen for all of that. So a person can come in looking for help with just prescriptions and also walk out with having applied for food assistance, with having applied for a vision assistance with the Lions Club, and getting help with prescription assistance.
Doesn't that make sense?
It does.
Because I think I can imagine anxiety-ridden some of these folks might be just walking into your doors thinking, oh gosh, they're probably going to tell me no. I don't want to be embarrassed. I don't want to be turned away.
Yeah.
But to come in and have you guys say, hey, you know what? This is kind of one-stop shop here. We're gonna get you hopefully what you need, and then also maybe alleviate some concerns you didn't even think to bring up.
You got it.
And that is just awesome. That's great news.
Yeah, it's amazing. And these are we say these are the wins. This is what keeps us coming to work every day. It's exciting work. Every opportunity, it doesn't always come through. Some things are a bit of a struggle, but we do our very best. And we get to see such wins in people's lives, such smiles, and there's lots of tears when things come through for them, but they're very happy and overjoyed at what we are able to provide for them.
What is your biggest win professionally as being part of the Health Project?
My biggest, I've got a great group of coworkers. They inspire me, honestly. And it's not, they inspire me. I will have to say that my current executive director, she and I started off at the same time. She came in as AmeriCorps, and now to watch her grow and learn That's inspiring to see the inspiring work of my other colleagues, Cindy Powers, who does the Lakeshore Lung program and the No Smoke program. They just inspire me by their care for the community, and they're authentic. Mimi Rankin does the diabetes program.
They are so authentic. I know all of those people you mentioned, and now after talking with you here on this radio show, I can imagine what it would be like to come into your office needing help and just having everybody scurrying around to see what can we do for these people. You know, that's the vibe I'm kind of getting here as somebody who would come in up from the community. Yeah. There is a stigma about asking for help. Mm-hmm. No matter what community you're in, right? Mm-hmm. It's like, I don't want people to know I'm struggling. I don't want to feel vulnerable, but if people can get past that hurdle, there are so many loving and happy people at the Health Project that can come to your rescue. So I'm hoping you're listening, Muskegon, and I hope that you take advantage of this opportunity to get in touch with some of the workers at the Health Project. How is the Health Project funded? How do you survive?
Well, it's a mixture. So we are funded through Mercy Health, the community benefit, but we also write for grants. So we receive state, local, federal grants that we've managed over the years. And so we kind of braid that funding together.
Okay. And I think you also provide grants to other community agencies and groups. I think I just saw a press release about you announcing some good news.
So there's the Sister Simone Cortate Fund that Mercy uses to help support other needs and issues in the community. And so the local agencies can apply for that funding and then be awarded. And they've got great ideas all the way from, helping with healthy foods to helping seniors. Mm-hmm. These are the ideas and the programs that we want to help and support in our community.
Yeah, last week we had the opportunity of talking with Sarah and Patty from the McLaughlin Grows Urban Farm. Yeah. And the things that they're doing for, healthy food, and we're partnering with that. And then, just being able to partner with the Community Health Project on things that are coming up. I'd like you to talk about some of the things you're zeroing in on right now. What are some of the initiatives that you're really, really putting a focus on at the Health Project?
Well, I think one of the main things that we're really zeroing in and promoting is our Pathways to Better Health of the Lakeshore. Okay. This is the program that sends community health workers out into the homes. And it's used for several different target audiences. So not only do we have a program to service individuals with chronic disease, but we also service the pregnant women that I talked about, high-risk pregnant women. But we also have community health workers stationed at Oak Ridge and at Muskegon Public Schools.
Yes, I saw that on your website, and that went from, correct me if I'm wrong, but a placement to check and help prevent head lice, correct, that now has grown into teen health centers and, health awareness. Yeah, let me hear more about that.
Yeah, so it did. It started with a community health worker who was grant funded, to help control a head lice issue. But she did such amazing work and saw such amazing need that they were able to contribute to being a part of having the Teen Health Center come out to Oak Ridge. And now we've got one community health worker stationed at the Muskegon Teen Health Center. And so we're able to do home visits to help wrap around families. Right. So the students and their family, because it's all a group, that we're able to support.
Okay, so that is the Pathways program is something that you're really focused on. Anything else that you have coming up the ranks that the community should know about specifically?
Well, the Health Project is involved in so much in the community. Again, I mentioned No Smoke, where we're out to, Cindy goes out to the schools and teaches children about preventing smoke.
And that has really had some great proven data that you have decreased active smokers in our community and your smoking cessation programs. I think we did a radio show on this about the zombie walk and some other things, and that's in the fall. That is usually around Halloween time. But Cindy has done phenomenal work around that. I'm sure you've heard of the medication take backs. We've helped with that program. You've literally taken back, like, I'm talking literally tons
of medication.
And when we say tons, we're talking like weight.
Yes.
Like TONS.
That's exactly. Things that you can measure, right?
Yes. Yes.
So it's perfect. So we've taken those medications off the streets. Mm-hmm. We've got them to a safe place where they can be disposed of properly.
Yeah.
There's that. There's Ally.
What's Ally?
Ally's I think it's the alcohol something initiative. Sorry, I don't know the middle initial.
Oh, that's okay.
Liability initial. I don't. I'm so sorry. But so that has helped to address alcohol and, again, substance use in our community, mm-hmm. helping to prevent those young ones from using alcohol.
So you're working, to promote alcohol awareness and the effects of alcohol with our teens.
Yes.
In our community. Does that have anything to do with the car simulator, the crash things, awareness? I've seen those out at the colleges mm-hmm. here in the community and at the high schools.
Exactly.
Around prom time and times where students would be celebrating something. So you are involved in that as well. So
that's another part that works under, I'm losing names now.
That's okay. What we'll do is we will send people to your website.
There you go.
And your website is www.mchp.org. Okay, because let me tell you about this website. Preparing for this radio show and then to talk with Tressa today, I had to figure out what am I going to not talk to her about, because there's so many tabs and links and videos and pictures and testimonials on their website. So if you are a community member wondering, where can I, and do you take volunteers? What if people are so excited about this, like I am, who are hearing this for the first time and saying, oh my gosh, I have spare hours that I'd love to be helping this organization with their initiatives. How can they reach out and get in touch with you?
Yeah. If they're interested in volunteering or they want to help, there's plenty of ways we have that they can plug in. But a phone number is 231-672-3201. And it's 231-672-3201. That's our main office, mm-hmm. and they'll be more than glad to help direct you.
Okay, so you probably have things you can volunteer for, like events.
Yes.
You have probably maybe some administrative things that people might be able to do, answering phones, et cetera. So they'll be able to kind of feel out what that volunteer's skills might be and place them in something that they'd enjoy.
Exactly.
Okay, good.
We can do that.
Lastly, tell me, you had talked that you've had a couple rounds now employed through the Muskegon Community Health Project. Why did you come back around?
I believe in the work that we do.
You got sucked back in.
I did. I believe in the work that we do. I have a passion for people, and to see an organization that truly walks out their mission, mm-hmm. I couldn't help but be drawn back to Mercy Health.
Well, thank you so much. And for those of you who are wondering what our mission is to serve in the spirit of the gospel, to be a transforming and compassionate, healing presence in our community. And there is no better organization that aligns with that mission than the Muskegon Community Health Project. Once again, visit their website, www.mchp.org. And the phone number one more time, Tressa?
231-672-3201.
Oh, thank you so much. And community, please, please, please take advantage of their services. They are here to help you. They are welcoming you with open arms. And their address is
565 West Western Avenue.
Okay, right downtown, across from the Caboose. You can't miss it if you're standing by the lake. All right. Well, your broadcast today has been brought to you by Mercy Health. Thank you so much for tuning in. Make sure to visit mercyhealth.com for more information regarding your health and what we're doing to support our community. At Mercy Health, we offer compassionate care, award-winning expertise, and the latest in technology, all in an inclusive faith-based setting that honors the sacredness and dignity of every person. At Mercy Health, it's not either or, it's all of these and more. It's Mercy Health.